So you're probably experiencing symptoms like some sharp lightning-like pain down the back of your leg. Sometimes it goes to the buttock, the hamstring, down to the calf and even to the foot. If that's the case, you've probably got sciatica. Now, sciatica simply means pain in the leg. The difficulty with sciatica is it can be caused by many different things. It could be a tight muscle, it could be a bulging disc, it could even be arthritis in the facet joints, which are a part of your low back. The difficulty with it is figuring out which one of these structures could be the cause, because all of them require different types of treatment. So when people come in with sciatica, they usually come in because of this intractable pain. They can't straighten their leg, they're having difficulty sitting for long periods. We have people coming with sciatica that it stops them from going to work or even going out on social events. And often it's not just that they're coming with it because it's been there for a couple of days. It's usually been unrelenting for some time before they get into the clinic. So the first step that we do with people is sit them down and discuss what's been going on. How long has it been there for? How far down the legs are going? Is there any weakness or numbness in the leg as well? Because all these things are crucial to know if we can help. Now, if we can help, we then want to go through a thorough exam to understand a bit more about the problem, where the problem's coming from, and then ultimately how to look after it. So that involves orthopaedic tests, neurological tests, checking the strength of the muscles in the leg, checking how much nerve tension there is if we start to stretch that injured nerve, and how severe the issue is. Now, often with these sort of things, imaging may be appropriate. So we'd take some motion study x-rays. If it's really bad, we might order an MRI to understand a bit more about it. But ultimately, once we get to that point, we should have a fairly good idea of how bad it is, what's going to take to get better, and then what sort of treatment's going to be effective for that issue. So first step is going to be come and book an appointment and find out what's wrong. Get a diagnosis, understand how bad that problem is and what's involved with the treatment, and ultimately, what do we need to do to stop this thing from coming back again?